by the people, for the people, the gathering to get healthcare now. It's a book by Don McCormick, Tony McCormick, and Blair Korndorfer. It's published by Tomorrow's Bread Today. In 2019, it became a bestseller book on Amazon. I'm Don McCormick. I graduated from the University of St. Thomas in Houston in 1967. I studied insurance at the University of Houston in 1968 and HMO management at Mills College in 1976. I've been licensed as a general line insurance agent since 1967. I was marketing director for New Community Service Corporation HMO in 1975. I organized and developed the first federally qualified IPA HMO in Texas in 1977. I served as president of Computech, a medical accounting software company, from 1980 to 1984. I was president of the National Association of Preferred Providers, 1984 to 1995. And I became executive director of SimNet IPA in 1996 and continue that work now. I founded and managed the Senior Patient Association, also known as Patient Physician Cooperatives, and it organized in 2006, and I continue in that work today. I'm the trustee for TBT, a 501c3 organization, and sponsor of the Patient Physician Association. I organized the Physicians ACO in 2012 and 13, and I am president of the PPC Multi-Specialty Group, an IPA in Houston. The economic ideas in this paper come from those described by Ernst Friedrich Schumacher, born in 1911 and died in 1977. He was a German statistician and an economist who is best known for his proposals for human-scale, decentralized, and appropriate technologies. He served as the chief economic advisor to the British National Coal Board for 2 decades and founded the Intermediate Technology Development Group in 1966. His 1973 book, Small is Beautiful, A Study of Economics as If People Mattered, was ranked by the Times Literary Supplement as one of the 100 most influential books published since World War II. Schumacher developed the set of principles he called Buddhist economics, based on the belief that individuals need good work for proper human development. He also proclaimed that production from local resources for local needs is the most rational way of economic life. Schumacher's experience led him to become a pioneer of what is now called appropriate technology, user-friendly and ecologically suitable technology applicable to the scale of the community. This book is available from Amazon in either electronic form or a printed edition. These readings of the book are Preface, followed by 32 chapters. Each part is about 10 minutes, and the videos posted on YouTube, and links are on our website, tbt.org and ppcwebsite.org. This is the preface. This book discusses the economic systems from a fresh point of view. It helps people to organize themselves into local cooperatives that satisfy their wants and needs in healthcare. It produces a new understanding of how healthcare economics will work when it is cooperative and not dog eat dog, and not somebody else's problem. It's a guide for how to create cooperatives that are economical and produce good health outcomes within the current laws and regulations. Making it universal can be done. It's not based on faith and hope, but cooperative action, education, trust, and love. Trusteeship and transfer of ownership of healthcare premiums paid to third parties by members of a health plan for future healthcare expenses is the core problem to solve in the United States. Insurance companies, employer-controlled trust, and health benefits managers prosper when healthcare expenses are less than was predicted by premium settings. Beneficiaries have not shared in those savings, but have continuously paid higher premiums and increased out-of-pocket costs for healthcare services. Consequently, money spent by member patients has not protected their health and welfare as intended. Payments of premiums to private companies, which contain funds for payment of future healthcare services and supplies, cannot be converted to profits by denial of payment or failure to properly predict future healthcare expenses. Payment of taxes and premiums in the Medicare and Medicaid plans in the United States are supposed to be in trust funds and price regulated by types of covered services. However, the methods used to claim and to distribute trust funds result in extraordinary waste in which most of the money goes to non-medical suppliers and facilities and not to providers of medical and surgical services. Less than 20% of the claims paid is for professional fees. The result is no valid accounting from the point of view of the member who pays taxes, premiums, and who seeks services. The result is members pay twice as much for health care in the United States as is paid in other countries that have universal health care systems. Direct payments by members to providers for services not covered by insurance are as much as the total cost of healthcare services in other industrialized countries. This includes Medicare premiums and out-of-pocket expenses. It does not have to be that way, and cooperatives can fix the problems. Healthcare is a human right. That idea is derived from a basic need for humans to cooperate with each other to survive. Such rights are built on foundations of material, labor, and love, and respect for each other, honesty and truth in our interactions. It is difficult to impose a right on any group of people by fiat or force, but it is even harder to deny that right when those people create it by individual labor and by collectively sharing material goods, teaching each other skills, and cooperating in the welfare of their families, friends, and neighbors. Whether the people in a gathering are rich or poor is of no consequence in the creation of their rights. What matters is that every human being in the gathering is cared for, and everyone who can provide skills and resources is participating. The economic and political systems in which rights can be established are mostly matters of opinion, but systems in which universal rights established by the participants are denied or become exclusionary or faulty. Capitalism and socialism have manifested such faults and need not have significant influence on the creation of a healthcare system by a gathering of people who love and care for each other. Healthcare for all can be built on a gathering in each community, everywhere. It should be enabled by honest trusteeship of required resources, which must be shared between the communities. Presently, governments in the United States are often not honest trustees, despite desires of many representatives to change laws and regulations to make trusteeship vibrant. Governments, state and federal, can help by creating risk pools under real trusteeship for large losses that the local gatherings cannot anticipate. However, the private sector plans must contribute to these risk pools if universal coverage is to be attained. Compensation of professional healthcare providers needs to be on a retainer basis adjusted by semi-annual retrospective analysis. Such analysis requires a relationship to both the problem treated and the cost of the service provided, material and labor. The current method of payment causes this analysis to be done after the services have been rendered and before payments are made, which results in three-way adversarial relationship between the professional, the insurer, and the patient. And the analysis is usually done by an employee of the health plan. Consequently, high prices, excessive services, denial of payments, and transfer of expenses to patients by copayments, deductibles, and exclusions create chaos and increase the administrative burden. Knowing the earnings of a professional medical care provider's wants and needs, his and her capacity to serve patients, and the frequency of his or her type service within a defined population determines the retainer. Most of the services of professional medical care providers do not rise to the level of sharing through insurance, but are merely a line item in a family budget. Retainers rather than premiums are far less expensive to both patients and the providers. They have added advantage of taking away adverse encounters between providers, insurers, and patients. Complaints about opacity of pricing, complexity of reporting, confidentiality of records, and independent verifications of transactions and payments are mostly solved from the patient and the provider's points of view. Individuals who cannot support a line item budget for professional medical care need income subsidy, not their uncompensated labor or tax payments to be given by paternalistic third parties to be reduced in value by their handling. The hospitals and suppliers are the elephants in the room. They are the big boxes, electrical mechanical devices, drugs, chemicals, and their investor groups, and they eat 40% of all the money available for healthcare. Patients can own all of these needed tools and reduce the load to 20%. When that happens, you will not have people confusing hospitals with medical care providers. It has never been that physicians needed to own these shelters, tools, chemicals, and medicines. They just needed to use them. It is best to operate hospitals at cost so that the surplus they now drain can expand the supply of medical care providers and restore wealth to those who struggle to get fair wages and proper support when needed. Hospitals should be owned by patient-physician cooperatives. It's the beginning of a system in which people matter, and they know it because they provide the ways and means.